Now, I'm delighted to say it's time to speak once more to Peter Hitchens, Mail on Sunday columnist, because it's that time. Peter, a very good morning to you.
Good morning.
So, you'll be pleased to know that this time we decided not to ask you to hang on for the end of the briefing from the government health people, because, quite frankly, we've seen this game before and we know exactly what they're doing.
Well, I'm grateful for that, because it was almost unbearable to stand in silence, grinding my teeth as this rubbish came out of the fronts of the faces of these people. I'm amazed at the sheer brass neck of them continuing to make these extraordinary claims. And then say, no, we're not predicting anything. It's not a prophecy. We're just saying, no, not us. And yet all they do is engender panic.
Right.
Panic engenders shutdowns, and shutdowns engender misery, loss of jobs, smashing of businesses, destruction of education, state interference with funerals, postponement of marriages, all this unending gloom and stupidity, which there seems to be no sign of any end to at all.
Well, we had a Tory MP on, Jake Berry, Conservative MP for Rossendale and Darwin, who admitted, I'm not sure whether inadvertently, that basically the virus, the government is not in control of the virus. And I said to him, well, if the virus is out of control, then why does the government keep trying to control it? And to which he said, I didn't say it was out of control. But clearly, that was his inference.
I mean, there is a fundamental fantasy here. I mean, there are things which governments can sort of control and things which they can't. I always point out that this is a country which has for many years been unable effectively to teach people to read, write, and count in 11 years of state education. So the idea that it can control a virus seems to be a bit of a stretch. It's like legislating for which way the wind should blow. There are things you simply can't do, and there is no evidence. There still has been, in all these months of trial and tribulation, no evidence at all that any of these measures that have been taken have actually affected events. If you look, as I say repeatedly, at the international picture, you cannot find any correlation between the severity of shutdown and the following result. It doesn't exist. And we've seen that in, I think, 19 out of 20 places on which these horrible things have been visited, no visible result. So what do you draw from that in the one place where it happened, it works, or that it doesn't work, and in the one place where there was a reduction, it had nothing to do with the measures? That would seem to me to be the intelligent deduction to draw. But people continue to assume. They assume two things. One, you hear it over and over again, if we'd shut down harder and faster, it would have been better. And the other is that, well, we have to put up with it because the government knows best. But the government doesn't know best. It's quite plain they don't know best. If they had the proper blazing beam of scrutiny directed against them by the media, which they ought to have had from the start, they would be shivering in fear. If they had a parliament which asked questions and which demanded explanations, they would be shivering in fear. If they were compelled to come up with the supposed evidence for their measures, they would be shivering in fear, because it's increasingly plain they have got no such evidence.
No, quite.
And when these northern local government figures say, well, can you please tell us why it is you're proposing to ruin us? They can't come up with it.
No. Well,
how is it these people remain in office?
I was slightly encouraged last week at Prime Minister's Questions when Keir Starmer actually asked for the evidence for the 10 p.m. curfew, but then the next day somehow went along with it. And we know that there is no evidence for it.
It's a strange aberration. You can't really understand what he thinks he's playing at. I think his instincts, oddly enough, as the instincts of so many left-wing people are in favour of more control, I think. I don't think he really deep down understands that this might not be right. He's a very interesting person, Keir Starmer, with a much more interesting background than most people realise. So people went on and on about Jeremy Corbyn being an old trot, which no doubt he was, a sort of steam age Trotskyist.
Yeah, still is really.
Keir Starmer also has a deeply, profoundly left-wing background, and was a member of a very small Marxist sect at crucial moments of his life. He's not actually a particularly radical thinker. It's time there was more attention given to him, I think.
Yes, I think that's absolutely right. But I mean, we've got a kind of a political weirdness, I think, going on, because a lot of the northern towns which are being targeted, we are told, seem to be in the grip of Labour administrations, if not local councils. But I don't think that's the important factor here. I think the fact is that, they're looking at the wrong data, as ever. I've got a piece of paper here in which there are listings of university campuses and university student populations, And all of them are where there is a high percentage of cases, whereby, for example, the top one in Nottingham, 54% of the population in that particular area where there are a large number of cases are students. And so the average age, apparently, of the infections is 21. And I asked Professor Karol Sikora how many of these kids are ill, and he said none.
No, I think that's probably right. I was patrolling my hometown, Oxford, yesterday, and came across, quite by accident, another testing centre, actually in one of our two universities. It was on the premises of Brookes University, the second university, which I hadn't even realised was there before. Right. But yet again, one says, if you look for cases, you will find them, and therefore these figures don't mean anything. I've been tracking the figures for hospital admissions since Matt Hancock said on September the 18th that they were doubling every 7 to 8 days. Actually, they haven't. There was one period of 8 days in which they did double. But the word every doesn't allow you to get away with that. It has to do it every 8 days. And they're not doing that. And the other thing is I've been trying to get out of the Department of Health or one of its quangos some sort of explanation. How many of the people who are listed as COVID admissions actually had COVID when they arrived? How many were found to have it after they arrived? How many of them have COVID symptoms? And it's remarkably difficult to get these answers. And of course, if you subject the admissions figures to serious analysis, you might find that they didn't mean what they appear to mean, just as the death figures for COVID didn't mean what they appeared to mean at the height of the outbreak back in March and April. People should learn to be, not necessarily suspicious, but at the very least more skeptical of the figures which are advanced by a government which was prepared to hold that grotesque non-press conference for which we delayed our chat a few weeks ago. These are not people who can necessarily be relied upon to be absolutely straight with us. And I think more suspicion is justified. And I shall continue to apply it. I just hope that my colleagues and so-called rivals do so as well.
Yeah, well, that's very true. I mean, again, another conversation with Professor Sikora. I said if there was any other kind of disease which had this level of kind of obsession from any government, you would be sitting there in your pajamas, absolutely in fear of death from the world. You know, I mean, for example, if they gave a press conference every day to say that around 500 people died yesterday of cancer, people would probably think that cancer might be a very dangerous disease, which indeed it is, which does indeed cost 165,000 people their lives every year in this country, but we don't make a big thing of it. And to have a press conference to say that one person died or 10 people died, I mean, it seems ridiculous.
Well, I'll say it again, 1,600 people, it's terribly sad in every case, 1,600 people die every day in this country for various reasons. And this is something which cannot be avoided and and will always be the case. The question is what sense you make of these figures. There's another very curious thing that's been going on. I think it's over now, but I haven't actually checked this morning. But last week there was this extraordinary Great Barrington Declaration, in which several major scientists of left and right, this was a politically unpartisan group, said that it was time that we adopted a different approach and allowed most people to live their lives normally while the vulnerable were protected if they wished to be. And this declaration received quite a lot of support, but if you went to the Google search engine and looked for it at certain points over the weekend, all you found were links to various websites abusing it. And saying rude things about it. The thing itself, I had to get down to, I think, page 7 of Google results to find a link to the actual document. This is really big. I think I got shadow banned by YouTube a few months ago.
I remember, yeah.
And you can't prove it, but what is going on here? Why do people think that they're entitled to keep from people an event as important as this? If the Great Barrington Declaration gets, and it still needs from some, particularly the BBC, some really serious examination, it gets the publicity it deserves. It makes it plain that one thing is not true. That claim that science is all on one side in this matter. There are scientists who profoundly disagree with the policies of most governments on this and think that others should be adopted, and they should be heard. So in whose interest would it be to make that declaration of these eminent people hard to find?
Well, this is right. And also, all of these kind of organisations like Twitter, for example, stepping in. Now, there will be plenty of people that say, Donald Trump shouldn't go around saying that he's immune from COVID. But we talk about herd immunity, and nobody suddenly says that's a completely ridiculous idea. Twitter's taken it upon themselves to suggest that Donald Trump has somehow misled the public by saying that he thinks he's immune. Well, he's the president of the United States. It's not really... I didn't realise that Twitter had suddenly become the sole voice of reason on how COVID works.
I think people have to understand that these enormous social media outfits are themselves partisan. They're not necessarily politically partisan to one party or another, but they are certainly at least partisan to, say, British newspapers, which are of the left or the right. And I think it would be it's time that people understood that that's what they're dealing with. I'm not a great enthusiast of Mr. Trump, as you know, so I'm not terribly distressed to see that happened to him. But
it's like you've often said, Peter. What if when they come for you, then it's you that gets affected.
I know, but I'm not. Then I have to defend myself and seek the help of others to do so. But I'm not going to, as a result of that, suddenly say I'm sorry if anybody else is attacked, and I will rally against them if they're unjustly attacked. I rally in their favour if they're unjustly attacked. But it's not going to make me stop being critical of people who are attacked just because they are attacked. Sometimes these attacks are justified. So I just do want to make it plain over and over again. I'm not a supporter of Mr. Trump or indeed of Mr. Biden, and I look at the American presidential election with nothing but despair for the future. But the thing that people must understand is that social media are not neutral, and that there are algorithms in operation, it seems to me, which create the sort of effects of the shadow banning that I think I underwent, though I could never prove it, and which seems to be in operation over the unavailability to people who use the most popular search engine of information about the Great Barrington Declaration. It's not. We don't live in a perfectly free society. If people shouldn't assume we do. That's my basic message.
No, indeed. Well, you won't be surprised to know that they're up to their old tricks at this briefing. Steve Powis, who apparently is the NHSE medical director, is up now, drawing parallels with France, where he says there has been a warning that without new measures, there we are, there's that great phrase, there will be 11,000 intensive care patients by the middle of November. I mean, they've done all this before.
Well, I think we should just write down these predictions, and when the date comes around, we should check to see what's actually happened, and then those who have made these predictions should be strongly held to account if they turn out not to be true.
Yeah.
Then again, one has to watch out for things which may happen between now and then, such as a redefinition of what an intensive care patient is, a redefinition of what a COVID case is. Whether it's with or of, and all these other things. You have to be careful. I was very interested by the way in which the admissions to hospital, allegedly with COVID, rose quite sharply on two occasions after the government started making an issue out of this, and after people began saying, well, test figures are not particularly indicative. The only things that matter are the deaths and the admission figures. Well, the deaths are still quite hard to manipulate in any substantial way. Obviously, you can, by classification, make them look bigger than they are. But the hospital admissions, I think, really do deserve a lot of serious examination of what they actually mean. And if figures of the kind projected in intensive care units are reached, then I think again we have to look and see what exactly these figures mean. I don't trust, I'm afraid, this government anymore on its use of statistics. I just find that over and over again, it's prepared to do things which appear to me to be reprehensible. And I think when we eventually have the inquiry into this, one of the things that needs to be looked into is the way in which statistics were presented.
I think the problem is, Peter, that a lot of people are in your position as well now. People who did support the government, who voted for the government, and who even supported, like I did, the original lockdown. I think more than at least 50% of the population, and that's my estimation. It's not any more true to form than any other statistic. But people that I talk to, people that call the show, people that tweet me, most people now in this country do not trust the government's data because they believe it's being manipulated in some way.
And yet there is still quite strong popular support for these new measures. And I think we have to be aware of the fact that the people still in general the great majority of people still in general believe that we are imperiled by a very, very serious disease, which, if allowed, as Mr. Hancock keeps saying, to let rip, will kill hundreds of thousands of people. And they're prepared to do all kinds of things, from mask wearing to staying at home to not going out in the evening to whatever it happens to be, because of this fear. And until that fear is dispelled, or until it's overcome, and I'm very sorry to put it like this, but until it's overcome by a fear of the appalling economic consequences of what's coming, I think that's going to govern public opinion. There won't be. My strong suspicion is there will not be serious resistance. It's beginning in the north because of the economic misery which comes with this latest shutdown. This thing will not seriously begin to be challenged until the hard economic consequences, the long summer dream, is coming to an end. People are actually going to find that they have no jobs to refer to, that the government money isn't coming. That's an enormous bill is going to be presented when Rishi Sunak finally summons up the courage to have the budget. And at that point, I think that it will be overborne rather than dispelled. People will suddenly find that they have much more pressing worries than an invisible virus which doesn't actually affect very many people. And at that point, it will go. But what I'm anxious to do is to try and prevent any more of this horrible economic damage being done before that happens. I think those of us who understand what's going on, have this absolute duty to say, for goodness sake, you've strangled the economy enough. If we're to have any economy or any life or any social services or health service or proper or even a proper functioning society at the end of this, we have to end this destruction of our life. And we also have to protect our personal liberty, because if you give it away, it's very, very hard to get it back. And there has to be a huge effort to say, well, that's enough. The government's giving too much power. I believe that the Simon Dolan court case is finally going to get before judges on Wednesday, unless they found another excuse to postpone it. Right. This is extraordinarily important because of the total absence of, say, proper parliamentary opposition. The only place in which this thing can be challenged is in the courts. And we have here a case at least as important as that of Gina Miller. But you wouldn't know it from the BBC or large parts of the newspaper press that it's even going on. It's hugely important that this case is properly considered and properly heard. And it would be absolutely tremendous if the judges would look at it and see that they've been given a responsibility to save hundreds of thousands of jobs and tens of thousands of businesses and huge.
And what are they tasked with on Wednesday? Are they tasked with deciding whether it's admissible or not?
They're not. The thing is, if they think that they're holding their hearing in silence with nobody looking, they may be less sensitive to the importance of it than if it's widely publicised. And that's why I beg anybody who has any role in media coverage who thinks this thing is serious to make sure that people are aware that this case is on. Because I think the mere fact that people are looking will make the courts perhaps take it more seriously.
Well, the thing about what we are doing here and what we are seeing is that logic dictates that whenever you look at what's been going on since March, you know, there are many logical fallacies being perpetrated by this government. For example, I'm looking at some slides now that Van Dam is putting out, basically talking about how infections have now gone up to something like 15,000 a day, as compared with back in April when they were only at 5,000. But back in April, they weren't testing anyone. And they told us back in April, we think there are 100,000 of these infections per day, but we're not measuring them. We're just guessing. So that was a guess. Now they're saying there was only 5.
Well, it just seems to me to be an abuse of position. Everybody who knows anything about this knows that these things are simply not comparing like with like. We were not testing at this level, and if we had been testing at that level, and indeed we've been testing, for instance, in care homes at that time, the results would have meant something wholly different. The question the point has to be made: these tests are not diagnoses. They're simply positive or negative tests, and many of them are quite possibly false. And the question which has to be asked over and over again is: these people may have tested positive, but are they ill? In March or April, we know for certain that a lot of people were. There are many of them, as I say, were in care homes or on their way to them. And by the way, have you noticed that Amnesty International produced last week a report on what happened in care homes, and it's barely reported or covered? it was very complimentary of what the government did. I urge people to find it on the web and see this is the sort of thing which a proper inquiry into what the government has done will find. But why wasn't this covered more?
Yeah. Well, maybe you could find, if you could tweet out the link to it, that would be great. We could all have a look at it, and I can retweet that.
I did last week. I'll do it again, but it's easy to find. Amnesty International Care Homes, and it'll come up. It's not one of those hard things. At least it wasn't last time I looked. Maybe it's Google it now. All you find is lots and lots of people attacking it.
Yes, absolutely right. One final word, Peter, just on the Darren Grimes situation, because I was sort of slightly tongue-in-cheek suggesting that a police officer might wish to come and sit in to the studio here with me to make sure that I challenge everyone that I interview enough so that I don't actually get threatened with arrest for not doing so. Or indeed, maybe we should go and sit in on some police interviews inside the police station to see how they're doing it.
Well, do you know, in pre-1914 Germany, a police officer used to attend all public meetings, taking notes.
Yeah.
And this is the way we're going. But people don't seem to realize just how politicized the police have become. It didn't just happen last night. And I do recommend my book, The Abolition of Liberty, for an explanation of what's gone wrong with the police and why it is that the failure to prevent crime actually walks hand in hand with an increasing willingness to interfere in free speech and everything that goes with it. The two are connected. You get more attacks on free speech from the police in a state where crime is not prevented than you do in one where crime is prevented.
I know, extraordinary stuff. Well, Peter, listen, as ever, thank you very much indeed. Enjoy the week. We'll look forward to your column on Sunday. We'll look out for the Amnesty International report as well. Peter Hitchens, Mail on Sunday columnist. Well, what can I tell you? You know, the briefing goes on, but there's a lot more interesting stuff coming out on talkRADIO. That's what I'm telling you.